Hello, this is Dr. Emmanuel. Welcome to my channel. Today, I want us to do a review of the anatomy of the radial nerve. And this is Emmanuel Academy. So this image is extracted from the Atlas of Human Anatomy by Frank Nettas. And on this image, we can see the brachial plexus. Okay, we can see a schema of the brachial plexus. On this image, we can see that the radial nerve has a nerve root of C5 all the way to T1. And we can see that the radial nerve is a terminal branch of the posterior cord of the brachial plexus. You can also see that the posterior cord is formed from it's formed from the posterior divisions of the three trunks, superior, middle, and inferior trunks. Their posterior divisions come together to form the posterior cord. And radial nerve is a terminal branch of the posterior cord, as well as the axillary nerve. So we can see that from this the schema of the brachial plexus. This image is extracted from Google. I saw it and I just fancied the image because it just gives the course of the radial nerve, excluding the muscle. So we can have, a visual image, of how the radial nerve courses from the axilla all the way down to your fingers, to your digits. So we can see that the radial nerve, emerges as a terminal branch of the posterior cord of the brachial plexus. We'll get to find out that it would actually exit the axilla through the triangular space, or the triangular opening, and then get to the posterior compartment of the arm, and then it will swell around, the posterior surface of the mid-humeral shaft, lying within the radial groove there, and then to come to the lateral aspect of the humerus, okay? And we'll find out that there, around the lateral aspect of the humerus, is going to pierce the intermuscular septum and come to the anterior compartment of the arm, okay? And there it's going to lie in front of the lateral epicondyle of the humerus. It's going to form one of the structures, one of the contents of the bicipital of the cubital fossa, okay, or the antecubital fossa on the lateral side, and then somewhere close to the apex of the cubital fossa, this radial nerve is going to divide into a superficial branch and a deep branch. And we'll get to see that the superficial branch will go to supply the posterior parts of the lateral or radial 3.5, digits, okay? And then we'll get to see that the deep parts or the profunda part of the radial nerve would, serves a muscular function, supplying, the extensor, the muscles of the extensor compartment of the forearm, okay? The forearm, of course, the hand. So this image is actually nice, yeah? So moving ahead, there is the radial nerve emerging from the axilla into the posterior compartment of the arm, passing through the triangular space. So this triangular space is bounded by the teres major. That's the teres major muscle, okay? Teres major, you can see extending from the angle of the scapula, okay, to the humerus. So that's the teres major muscle, forming the upper border or the base of the triangular space or the triangular aperture. There we can see the long head of triceps forming the medial parts, and then we can see the lateral head of the triceps / the humerus forming, a lateral border. So the lateral border is formed by the humerus and the lateral head of the triceps. The medial border of this triangular space is formed by the long head of the triceps, and the base of the triangular space is formed by the teres major. So this radial nerve right there, that's the nerve, emerges from the axillary space or the axillary compartment into the posterior compartment of the arm through this triangular space, okay? It's also called triangular interval or triangular aperture. So it enters there, and we can see that it spirals, it runs through the radial groove, okay, of the humerus. The radial groove, which is spiral groove, it spirals through this groove, okay. And while within this radial groove, you see it's supplying, it's giving off branches to the long head of triceps, the lateral head of triceps, the medial head of triceps, okay. It innervates the triceps muscle, okay. And then we can see the radial nerve extends, it runs within this radial groove, okay, and then gets to the lateral part of the humerus and pierces this lateral intermuscular septum, okay, and this is the posterior compound. So by the time it pierces, it goes through this lateral intermuscular septum, it will go to the anterior compartment of the arm, as we can see here. It's coming from the posterior part, it pierces the septum, and it comes to the anterior aspect of your arm. So it gives off muscular branches to the triceps, all the heads of the triceps. It also gives off some cutaneous branches, which we'll get to see. Okay, we'll get to see the cutaneous branches of the triceps. So let's move ahead. And that's the branch to the anconeus, this one, that's the anconeus muscle, okay, which is a triangular muscle. So you can see this branch going all the way down to the anconeus, right? Yeah. So it pierces the intermuscular septum, as we saw, runs in front of the lateral epicondyle of the humerus, okay? Courses, through the lateral parts of the antecubital fossa, and then it gets to the forearm. So there is dividing into the superficial branch. So that's the superficial branch, which is smaller branch, because the superficial branch is just a cutaneous branch. That's superficial branch of the radial nerve, and that's the larger deep branch of the radial nerve, okay? This deep branch of the radial nerve gives off supply to muscles of the extensor compartment of the forearm. As we can see here, we can see the brachioradialis, okay? It innervates the brachioradialis, innervates the extensor carpi radialis longus, innervates the extensor carpi radialis brevis, okay? So we can see the brachioradialis, we can see the ECRL, we can see the ECRB brevis. It also innervates the supinator muscle. So this deep branch, you can see it runs through the substance of the supinator muscle. That's the supinator muscle there, that large muscle. It runs through the substance of the supinator muscle. And then when it emerges from the supinator muscle, it's then called the posterior interosseous nerve. Okay, so the posterior interosseous nerve and the deep branch of the radial nerve are actually the same thing. It's just that when the deep branch emerges from the substance of the supinator nerve, that's why you now call it the posterior interosseous nerve. Remember, the anterior interosseous nerve is a branch of the median nerve, whereas the posterior interosseous nerve is a distal continuation of the deep branch of the radial nerve, okay? You can see it is just giving off muscular branches, okay? So that's the extensor digitorum, that's the extensor digitorum muscle, that's the extensor pollicis longus, okay? Extensor pollicis longus, that's the extensor indicis muscle, okay, going to the index finger. That's the abductor pollicis longus, okay? Abductor pollicis longus. This is extensor pollicis brevis. So all these muscles are supplied by the deep branch of the radial nerve, or the interosseous, the posterior interosseous, nerve, which is just a distal continuation of this deep branch. And we can see that this superficial branch of the radial nerve is purely cutaneous. So it's that superficial branch that emerges there. Okay, superficial branch of the radial nerve. You can see where it is. It runs anteriorly on the anterior part or anterolateral part of the forearm, and then it emerges right there. So it seems to be emerging between the brachioradialis tendon and the tendon of the extensor carpi radialis longus. Let's go back to that image. So you see it's emerging between the tendons of brachioradialis and the extensor carpi radialis longus. So that's the superficial branch of the radial nerve emerging there. And it gives off the dorsal digital branches, okay, to the thumb, to the index finger, to the middle finger, and also to the gives off to the radial half, okay, of the ring finger. Yeah. So let's look at the sensory branches of the radial nerve. So when the radial nerve is within the axilla, while the radial nerve is within the axilla, it gives off the posterior cutaneous nerve of the arm. Let me see if we can find that there. So posterior brachial cutaneous nerve, okay? That's it. The posterior brachial cutaneous nerve, or you can call it the posterior cutaneous nerve of the arm, which is a branch of the radial nerve. So it's a branch of the radial nerve, but it's given off while the radial nerve is still within the axillary compartment or axillary space, okay? Then when the axillary nerve, is within the radial groove of the humerus, it gives off the inferior lateral cutaneous nerve of the arm, or as it's written here, inferior lateral brachial cutaneous nerve. Okay, I think when I learned it as inferior lateral cutaneous nerve of the arm, not brachial. And it also gives off this posterior antebrachial cutaneous nerve, or you can simply say the posterior cutaneous nerve of the forearm. So these two nerves are given off while the radial nerve is within the radial groove, okay? While the posterior cutaneous nerve of the arm is given off while the radial nerve still lies within the axilla. And we can see right there on the posterior aspect of the arm, that's where you have the posterior cutaneous, innervated by the posterior cutaneous nerve of the arm. On the lateral side of the arm, we have the inferior lateral cutaneous nerve of the arm, okay? Because the superior parts of the posterior arm is supplied by the axillary nerve, okay? The superior lateral, the barge area. And then the posterior cutaneous nerve of the forearm, okay, or the posterior antebrachial cutaneous nerve supplies the posterior parts of your forearm. And then this superficial branch of the radial nerve, the superficial branch, you can see it's written the superficial branch of the radial nerve and dorsal digital branches, okay? The superficial branch of the radial nerve emerging on, at the distal part of the forearm, then supplies the fingers, the back of the hand and the back of the thumb, index finger, middle finger, okay? It doesn't supply the nail beds. Nail beds are supplied by the median nerves. The median nerve supplies the palmar area and, and bends to supply the distal parts of the fingers, okay, of the digits, the nail bed area. So clinical correlation or clinical relevance, of the radial nerve. So in terms of radial nerve injuries, commonly when people use crutches, like the conventional crutches, let me show you. The conventional crutches that are anchored in the axilla like this, they can easily have developed compression of the radial nerve. So crutch palsy, Saturday night palsy, so named because anecdotally, people come back from the club at night on the weekend, and they just hang their arm over the chair and sleep off. So that's that the arm of the chair then presses into the axilla, compressing their radial nerve. So if you have a fracture of the mid-humeral shaft, you can have, radial nerve injury. Remember the radial nerve when it pierces the intermuscular septum, the lateral intermuscular septum of the arm, and then it now lies anterior to your lateral epicondyle of your humerus. Okay, so if you have, let's move to that image. So this is what I'm talking about, where the radial nerve lies in front of the lateral epicondyle of our humerus. So if you have an elbow dislocation, we have a distal humeral, fracture, epicondyle fracture, can all cause injury to your radial nerve. Okay. I hope that's making sense. If you have a tight POP cast, it can cause compression, neuropraxia. Above the wrists, especially the cutaneous aspects, if you have a tight jewelry, and what is called the Wattenberg syndrome, which is radial nerve entrapment deep to brachioradialis tendon. So if we go back here, we can see the brachioradialis tendon, between the brachioradialis tendon and the extensor carpi radialis longus tendons. You can see the superficial branch of radial nerve emerging. So if you can have a nerve entrapment there. But this wouldn't cause wrist drop because it's purely a sensory nerve palsy. Okay, you have a sensory neuropathy, but you wouldn't have a muscular neuropathy. So you have, paresthesia or loss of sensation or numbness, around this area, this part of your hand and fingers, but you wouldn't have wrist drop because it's a sensory neuropathy. So there's something called the triangular space syndrome or triangular interval syndrome. And this is simply when the radial nerve gets entrapped, okay, within the triangular space as it exits from the axilla into the posterior compartment of the arm. So anything that causes, increase, that causes a narrowing of this triangular space, maybe hypertrophy of your triceps, hypertrophy of your teres major muscle, anything that narrows the space can compromise your radial nerve. And of course, the profunda brachii artery also passes through this triangular space, and the profunda brachii is it's a deep branch of the brachial artery, so it also passes through this space. So anything that compromises this space can give you a radial nerve palsy. That's usually going to, so clinical presentation, radial nerve injuries usually present as a wrist drop. So this is what a wrist drop is. You can see this patient is fully able to extend his left hand, his left wrist or left hand, but he's not able to extend the right wrist, okay? So that's what's called a wrist drop, okay? It's called a wrist drop. It presents as wrist drop, and depending on the level of injury, if it's at the level of the axilla, often above the axilla, or if it's at the level of the radial groove of the humerus, a mid-humeral shaft fracture, you could have difficulty fully or strongly extending your forearm, your elbow. So depending on the level of the injury, that will determine the clinical presentation, whether it's going to be purely sensory, whether it's going to be a mixture of sensory and motor deficits, whether the weakness solely be at the level of the wrist, by way of a wrist drop, or whether you also have a triceps weakness. Okay, if it's coming from, if the injury is coming from within the axilla, you will have almost complete weakness of your triceps, so you wouldn't be able to extend your forearm also. Okay, but if it's a mid-humeral shaft fracture, usually some of the heads of the triceps would have already been innervated, so you just have a partial weakness of your triceps, not a full weakness of your triceps. So we said this, what the conventional, crutches, looks like, pair of crutches looks like, pressing into, digging into your axilla, causing, pressure on your radial nerves and the rest of your brachial plexus. So, these are modern crutches. So these ones just don't get to your axilla, okay? So you bear the weight solely at this point. It doesn't dig into your axilla. So we've come to the end of this revision of the radial nerve. We've looked at the cause of the radial nerve. We've looked at the muscles that are innervated by the radial nerve. We've looked at the cutaneous, branches of the radial nerve. We've looked at clinical relevance, of radial nerve injuries. Feel free to watch this video over and over because somehow repetition enhances understanding and retention. Okay, so if you have any questions, any comments, just leave it in the comment section. Kindly like this video, subscribe to my channel so you'll be notified when when other videos are published, and also share this video with your friends. Thank you very much.